Hello. Welcome to a brand new community health nursing lesson. My name is Jessie Wheatley and I'll be facilitating this lesson. Please make sure you have your notes in your notebook ready so you can follow along with this lesson. Thank you for listening to this lesson. This lesson covers environmental health concepts. This is just a quick highlight on environmental health concepts, and by the end of this lesson, you should be able to explain how the environment influences human health and disease. You should know which disciplines work most closely with nurses in environmental health. You should describe legislative and regulatory policies that have influenced the effect of environmental health on health and disease patterns. And you should describe the skills needed by nurses practicing in environmental health and apply the nursing process to the practice of environmental health. Nurses have responsibilities to be informed consumers and advocates for citizens in their community in regards to community and environmental health issues. Models describing the determinants of health acknowledge that we understand health and disease is very much impacted by the environment. For many chemical compounds, whether they're new or familiar, scientific evidence about the possible health impact is lacking. So nurses are busy scrounging through data to make sure that they understand how some of the chemicals and compounds impact the health of our community. Prevention activities that nurses can be involved in the environment include education, waste minimizing, and land use planning. Control activities can be environmental permitting, environmental standards, monitoring, making sure compliance and enforcement is available, and cleanup and remediation. Okay, let's talk about environmental health assessment. Each nursing assessment should include questions and observations about the intended and unintended environmental exposures. So we want to make sure that when we are assessing our patients, we're making sure we understand what they've been exposed to, intentionally or unintentionally. Okay, environmental databases facilitate the easy and immediate access to the environmental data useful for assessment in diagnosing and intervention and evaluation. There are databases that are available that tell us how chemicals impact health. Both case advocacy and class advocacy are important skills that nurses in the environmental health practice have to have. We want to make sure risk communication is an important skill, and they must acknowledge the outrage factor experienced by communities with environmental hazards. So nurses may be involved in risk communication. Federal, state, and local regulations exist to protect citizens of environmental hazards. Nurses can be aware of those and can help facilitate those. Okay, so when an exposure history should identify current and past exposures. We talked about that. Um, and you should have a permanent goal of reducing or eliminating that exposure. So if somebody says they're exposed to environmental toxins, we want to make sure they either eliminate or reduce that exposure. And we want to make sure the long-term goal is that we reduce the adverse health effects that are going to come from that exposure. I have included a handout. It's called an I Prepare assessment to kind of remind nurses about the important questions that they can categorize to be remembered when they are doing an environmental health assessment. That's a really neat tool, so check that out. Health practice engages multiple disciplines. It's not just nurses that are going to be doing this, and nurses are going to be an important part of the environmental health team. Environmental health practice includes principles of health promotion, which nurses are good at, disease prevention, we're good at, and health protection, we're good at. I want to make sure that you know that the Healthy People 2020 addresses targets for the reduction of risk factors and diseases related to environmental health issues that you should be aware of. And environmental justice is the goal of the campaign to make sure that we seek to improve unequal burden on environmental risks, and especially among impoverished or minority communities. Okay, an example of that is the Environmental Justice Act that would be used that nurses can be involved in advocating. Okay, Uh, Environmental health and employees. It's very important that we make sure that employees have the right to know about the hazardous chemicals which they work with, whether they're inhaling them or they're touching them. Employers must maintain a list of all hazards in their chemicals that are around the premises. That's why you've heard of the MSDS sheets, material safety data sheets. Those are used to make sure that we communicate the health risks related to safe use and handling of those chemicals. Okay, I want to also point out that conducting a windshield survey is a useful first step in understanding the potential environmental health risk hazards. As you submit your windshield survey this week, I hope you actually get to share and look through your environment and see what puts people at risk. Okay, so the windshield survey provides firsthand information about the community and areas of concerns that must be investigated. Okay, education is the primary preventive strategy when it comes to environmental impact. When examining sources of environmental health risks in communities and planning intervention strategies, it's important to apply basic principles of disease prevention. Thank you for listening into this lesson. I hope you have enjoyed this quick overview of ethical and cultural influences in community health. For questions about this lesson or corresponding notes, please feel free to email me. Have a lovely day. Thank you for listening to this presentation. I hope you have enjoyed this overview of environmental health concepts. For questions about this lesson or corresponding notes, please email me. Have a lovely day.